Are we going to do the introducing in order or?
Yes, you can do it. Dr. Simwak Alam.
Yeah.
Could you please introduce yourself?
Yeah. Hello, everyone. I'm Dr. Simhachalam. I'm an MBBS graduate from India.
And could you please share your screen?
Yeah. Yeah. Is my screen visible?
I hope we can. Yes, we can see now.
Yeah. Thank you. Yeah. Hello, everyone. I'm going to present my paper on an assessment of peptic ulcer perforation score, a predictor of mortality following peptic ulcer perforation from a rural tertiary care setting. So, peptic ulcers result from the increased aggressive or decreased protective elements in the stomach or duodenum, which can gradually cause mucosal damage and ulceration. The risk of death in these cases as a consequence of peptic ulcer disease is highest in case of perforation. Therefore, early identification of patients with perforated peptic ulcers who are more likely to experience negative outcomes after surgery is crucial for making the right treatment decisions. Hence, this study was aimed to use the peptic ulcer perforation score to protect and predict mortality within 30 days of surgery in the risk stratified patients undergoing surgical therapy for perforated peptic ulcers. So, the objectives of the study are to use the peptic ulcer perforation score to predict mortality within 30 days of the surgery and to risk stratify patients undergoing surgical therapy for perforated peptic ulcers. Come to the methodology. Between November 2016 and October 2020, for the 4 years, we followed up patients who presented to the hospital with symptoms of hollow viscous perforation and intraoperative evidence suggestive of perforated peptic ulcer were included in this prospective study. The study included all individuals who were older than 18 years who had hollow viscous perforation, which is together with intraoperative findings indicative of perforated peptic ulcer, and were willing to provide written informed consent for the investigation. So coming to the result, in total, 120 patients were included in the study, which includes 94 men and 26 women. The majority of the patients, out of 68 out of 110, were in the age group 41 to 60 each. And 110 patients were in the low risk group and 10 patients were in the high risk group. In the postoperative period, 8 patients from the high risk group passed away compared to 2 deaths in the low risk group. Male patients made up were 28/46 of those with duodenal perforation and 66 out of 74 members are those with geriatric perforation. So, although perforated peptic ulcer can occur at any age, we found that the youngest patient in our study was 18 years old and the oldest was 91. Perforations of peptic ulcers are frequent in the 3rd and 4th decades of life. In a study by Koser et al. And a study by Taco et al., the average age of PPU, that means perforated peptic ulcer patients, was 43 years old and 41 years old. So recent research from Moller et al. And Thorson et al. Revealed older age group patients as being the most frequently affected age group. So in our study, the mean age group was 41 to 50. So coming to the conclusion, the prognostic markers employed in the PULP score are simple to use and straightforward to be identified before surgery. So the PULP score can help with the quick and accurate identification of high-risk patients, which can help with risk stratification and triaging of perforated peptic ulcer patients. So this concludes my presentation, and thank you for this opportunity.
Thank you very much. Is there any question? Olcan, maybe.
Unfortunately, I wasn't able to join from the beginning, but thank you for your presentation.
And thank you, sir.
And could you please stop sharing your screen? By this way, Dr. Goran can just begin to share. Thank you very much.
Thank you. Thank you.
So, good afternoon, everyone.
Yes.
This is Ed, and I'm also an MBBS graduate doctor from India. I graduated in the year 2021, and currently I'm working as a junior resident at All India Institute of Medical Sciences, Rishikesh. So I also thank you all. I would like to thank the committee for providing me this opportunity to share the research work where Dr. Simhachalam is also one of the co-leads. So I'll start sharing my screen. Just
Yes,
give me a-
please.
Can you please let me know whether you can see my screen or not?
Yes, we can see, but it is not whole screen.
Okay, now can you see this completely?
Yes.
Okay, so the title of this study is the prevalence of metabolic syndrome, its
Yes,
risk factor, and the associated complications among the rural populations of Andhra Pradesh, state in the southern parts of India. So as we all know that metabolic syndrome is defined by a cluster of factors, namely central obesity, glucose intolerance, hyperinsulinemia, excess of lipoproteins, cholesterol, triglycerides, and systemic hypertension. Now, just like the rest of the world, the Indian population has seen a recent surge in the cases of metabolic syndrome, and that has been attributed to a shift in the lifestyle of the people, resulting in adjusted activities of daily living, especially in the urban settings, and which the effect is also now, we are starting to see in the rural settings too. Metabolic syndrome, as you all know, being a metabolic disease, has the potential to double the risk of cardiovascular diseases, as has been found in many studies earlier. And we all know it is one of the leading causes of mortality globally. Now, there are, just like any other disorder, there are certain factors which are modifiable, but certain which are non-modifiable. So there's an early identification of metabolic syndrome, a clear-cut understanding of its risk factors, is crucial for context-specific interventions. So with the objective to estimate the burden of metabolic syndrome, its risk factors, and the complications among the rural adult population, we conducted the study in the year 2017, between February 2017 to October of 2018. Now, the healthcare system in India is divided primarily into three categories. That is the primary health centers, the secondary health centers, and tertiary health centers at the top. So this study was conducted at 5 primary health centers, which encompassed 26 villages. At each of the PHC, there is a 24-hour service, and on 3 days of the week, they run a non-communicable disease clinic. And metabolic syndrome being one of the non-communicable diseases, we included 2,250 patients who were availing services in the NCD clinics. It was a community-based cross-sectional study and conducted among adults who were visiting the clinic. The only exclusion criteria were people who were not mentally sound, seriously ill patients, pregnant, and lactating mothers. Coming to the results of the study, the majority of the participants belong to the age group of 45 to 59 years. 56.8% of them were females. Of the 72.8% were married. And utilizing the BG Prasad state of socioeconomic status classification, we found that 28.8% of them belong to a lower socioeconomic status. There was statistically significant reliability for HDL and excellent reliability for triglycerides and fasting blood sugar levels. The prevalence of metabolic syndrome was found to be 34.6% among the study participants. Most commonly deranged component of the many component of metabolic syndrome was central obesity that was seen in 63.6% of the participants. Univariate analysis showed that females were found to have higher chance of metabolic syndrome. And of the other factors, age, upper socioeconomic status, low food intake, physical inactivity, and a perceived stress were significantly associated with metabolic syndrome. This led us to believe that, we found that 34.6% of rural adults had metabolic syndrome. And the prevalence of metabolic syndrome around the world has been reported from 7.9% to 39%. And in our study, it was found to be on a higher end, especially in India, where the reported prevalence had been from 9.2% to 43.2%. The variations in prevalence could be attributed to adoption of different criteria for metabolic syndrome, difference in study settings, difference in laboratory techniques, as well as risk factors. To conclude, in this study, the incidence or the prevalence of metabolic syndrome was on the higher end of those which were previously reported. We believe that with our findings, we conclude that the focus should be given on promotion of healthy lifestyle, especially among youth, and early screening for risk factors such as obesity, lack of physical activity, and most importantly, perceived stress. And thus necessitating specific cost-effective and feasible interventions to reduce the identified risk factors as needed. With this, I would like to conclude my presentation, and all three of the authors declared no conflict of interest.
Thank you very much. May I ask that, did you ever consider about the things that has been between urban and rural? Has this made any change about metabolic syndrome?
I'm sorry, can you please repeat your question?
I'm asking that, is there any differences with the socioeconomic status being in urban and rural? Does it change anything?
With respect to socioeconomic status in the urban and rural settings, I'm not sure. I mean, it might affect, but I'm really not sure.
And also, what about the digital addiction? Are they always sitting in one position, or something else could just affect their metabolic syndrome? Do we know?
Digital addiction, can you
Yeah.
please elaborate what you mean by?
It is about the screen time. If the screen time is so high, that means it is much more effective about being obese. That's
Yeah,
why.
that
Yeah.
is one of the factors that could be considered, but here there are many confounding factors. Firstly, because people in urban setting, especially in higher socioeconomic status, they have more exposure to screen time as compared to those belonging to the same socioeconomic status in the rural setting. And also because there is a better network access in the urban settings. So people in urban area tend to use, that is what I believe, but definitely we have not studied in this particular study,
All
which
right.
could contribute to this.
Thank you very much. Nilgün Hocam, sizin sormak istediğiniz bir şey var mı?
Ben biraz geç katılabildim de o yüzden hani çok yorum yapamayacağım. Kusura bakmayın. Bundan sonrası.
Hoş geldiniz.
Evet. Ders ancak bitti çünkü.
Elinize sağlık olsun. Ferhat, ekranı paylaşır mısın?
Tabii ki.
Hoş geldin.
Hoş buldum. Okay.
Yes. Here we go.
Does Zoom thing block the writings?
Yes,
For
we
you to-
just see everything. There's no problem
okay,
about
okay.
that.
Okay, so I'm Ferhat. I'm not a doctor yet, but after seeing your presentations, I mean, I got a bit anxious because you got lots of data and everything. Okay, as you can see, with my advisor, Özden Hanım, we thought of conducting a questionnaire or a research or a study. I want to make an entrance first with the idea and how the idea came. As I have written, in times of COVID-19 pandemic, online education was thought to be one of the life saviors. And after this massive earthquake in the southeastern part of Turkey, which approximately affected 10 cities, we as university students, went back to online education. And not only so we have seen that not only in times of pandemics or diseases, in terms of other disasters, we can use online education too. So we started thinking about and talking about the efficiency of this online education thing compared to face-to-face education with our friends and of course our teachers too. So again, as I have written, attending and participating effectively and the amount of participation became hot topics again. And our study here aims to gather data on effectiveness of face-to-face education and online education, and also to compare and evaluate how effective it is. Well, our methods here contains a questionnaire which will be applied on 6th graders, well, of course, from Faculty of Medicine, but you'll see that we are also thinking about applying or making other faculty students, like Faculty of Law students, answer these questions as well, but that's still a bit in the thinking process. And this questionnaire will be anonymous, and we are planning to give codes or assign codes to participants who are going to answer the questionnaires so that they can stay anonymous. But yeah, that's it. And well, we don't have results and conclusion part yet because we haven't yet applied it. And moving on with the discussion questions, the first question is, what are the methods that can be used to conduct a research on effectiveness of education? And can academic performance at the time of first questionnaire be a criterion? I have written first questionnaire here because we were planning to, well, we still are planning to apply the questionnaire twice, one in the times of crisis and one after the crisis, or the disaster in these conditions. So we are thinking if this is if the results that we get after or in times of crisis are reliable or not. That's one of the questions. Second question, how can students' attendance and participation be evaluated? Is a questionnaire including student answers only enough, or should lecturers answer the questions too? That's another question. The third question is, will it be appropriate to compare engineering, law, and visual arts faculties with the Faculty of Medicine? This was the part that I was trying to talk about. We are still in the thinking process of adding other faculties and comparing the results with them. And I want to conclude it like this. Thank you. And thank you again for the opportunity as well.
Thank you very much. But the truth is, Ferhat was trying to present a case study, and the case was his own experiences, because he is saying that when we are making this online education, lots of the colleagues or the teammates are not attending, and also lots of them are not only listening to lessons but also opening other windows and maybe chatting, maybe playing or maybe watching film and so on. So to make the lessons face-to-face wasn't as effective as the online ones. As you may see, we are here in 6 persons. One is our lecturer, the other is just helping us as a technician, and he is a doctor. And one is Suzanne. Suzanne is also in lifestyle medicine. We are working together. The other is Gurang Park, and he is also one of the presenters. So when we look at our little community, we can see that the people who feels responsible are here, not the ones we announced to be here. Maybe they will watch it later. I'm not sure. And so this was the case that Ferhat was trying to tell you. But afterwards, I don't know why he just make it to go on. Yes, thank you very much, Suzan. He just made an opportunity for this to try to get involved with our community, with lecturers and students all together. Because from myself, it is very a good opportunity to talk with you. Although some of us are from India or Izmir, but we couldn't see each other. But again, it is not the same with just being together, not touching, not seeing, not smell, nothing else. But we are in the working area of medical. And in medical, there are lots of things that we are just identifying with the other parts, not only seeing. So that was the question. And so now the stage is yours, as we are a little audience. Would you like to say anything about this presentation?
Yes, it's a good idea, I think, to research this topic, research on this topic. Did you did this research, or you are planning?
We're planning, yes.
Planning. Okay, you can plan. It will be nice. At the first question, I think you can use your questionnaire evaluating the effectiveness of the presentation or the lecture. You can ask how did the students learn about this section, learn how did they try to catch their effectiveness of the lesson. And you can also look at their academic performance. This will be a criterion for the effectiveness of the education method. And also you can ask after the lesson, the second time, in June, you can ask for a second time, and you can research and calculate the difference. And also, it is appropriate to compare engineering, law, and virtual arts faculties. But be careful. The lectures and the lectures aim and the ways of the lectures, how they conduct to how it is used, how it is necessary for the students, will be nearly the same. You can then you can evaluate or compare these different faculties lessons.
Thank you very much.
Thank you.
Well, the aim is very important because for the family health center visits, Farhat and the others will just go to Olcay, for example. Yes. And
Okay.
if you say that you just want to do it face to face, now here we go again. We will
Okay.
see then who is going and who is not. Maybe they will say that we see each other and we know there's no problem. We will see. Thank you very much. This was the last session, and thank you very much for attending. I do hope we can see you for tomorrow. Değil mi Olcay?
Yes, exactly.
Thank you very much. And wish you luck for your exam, Farhat.
Thank you.
For tomorrow. See
Okay.
you.
Bye, everybody.